Hi, my name is Robert Haskins. I'm a master handwriting analyst, graphotherapist, diagnostician, and I do handwriting analysis. For those of you who don't know what handwriting is brain writing. When you write, your signature is an expression of your conscious mind. Anything other than your signature is an expression of your subconscious mind. We call it graphotherapy. Now, graphotherapy coincides with psychotherapy, invented in the 1890s by Freud and Jung. They advocated that learned experiences from the inner mind, which is also the subconscious mind, helps to shape childhood experiences, which are responsible for who you are. When you sit down with me, initially, you don't talk, you write. And I let you know what you're doing in your life right now, what you've been doing for the past 3 to 5 years, what you've done in your childhood that you brought in your adulthood that's affecting you. Namely, your emotional disposition, aspiration level, consistency, explorativeness, mental communicability, extrovert, introvert, manic depressive states. Such that we don't tell you what to do, but we introduce you to latent personality and character traits in your subconscious mind, or from your subconscious mind, that you've had since your beginning. Now, it's important for us to let people know that all is not lost. It seems like every day you hear about someone who has committed suicide or went through an untimely death. One of our dear friends, Don Cornelius, who started the Soul Train, has went through a suicide situation. And everyone, family members, loved ones, and people, estranged people have said, what happened? How did this happen? Now, this is where we come in as a handwriting analyst. We can take their handwriting, and from their handwriting, we can tell what happened to the person in terms of the suicide, in terms of the subconscious mind and what he was going through, such that we can help people help themselves in terms of this situation. Now, oftentimes when we go through different traumatic situations, we really don't have anyone to talk to. And that our system has been in trouble for a long time. And interrogating a person doesn't accomplish what it should accomplish. In this situation, it's most important for his family members, as well as his personal friends that loved him, to understand and know what happened. Now, we can do this without evading a person's privacy by doing a handwriting analysis. We call it a personality reconstruction. When we do this personality reconstruction, we can let a person know exactly what the victim was going through and how they were feeling. We can also do early detection of stress depression levels 1, 2, 3, 4, and 5, as well as if in fact the person had ADHD or a bipolar condition that they were dealing with. Now, when one is dealing with an ADHD situation and it's not being treated properly, in that drug therapy is not the answer. And when you can get a person on herbal therapy plus a counseling from graphology, their handwriting, and they know two people write alike, and it's unbiased, then the person stands a chance of being helped more emphatically. Matter of fact, it has been known that within 3 to 6 months after one goes through ADHD condition, that we can help them. Now, say for instance, a person who has committed suicide or has had an untimely death had been going through therapy or had been sent to us, then we can tell, in terms of doing early detection of stress depression, if in fact a person has ADHD, if in fact a person has suicidal tendencies. We call it extreme self-blame. We have a method of measuring the severity of people's conditions called the relative intensity. And 0 to 5 is normal, 6 to 25 is concerned, 26 to 50 is very concerned, 51 to 75 is critical, 76 to 100 is very critical. Now, when we do the relative intensity, we can find out and let the people know what's necessary for them to do. Oftentimes, a person isn't ready for counseling or therapy, and they need what we call an herbal treatment. And once they go through the herbal treatment for 4 or 5 weeks, then they're ready to sit down and discuss their situation with us. Here again, keep in mind, we don't ask them questions. We reveal to them what they're doing in their life right now, what they've been doing for the past 3 to 5 years, what they've done in their childhood that they brought in their adulthood that's affecting them, such that they can see and understand who they are. Then, we not only can say, John or Mary is ready for counseling, and that we don't do therapy. It's not correct for us, coming from where we're coming from, to do therapy on a person when they really don't know who they are and what they are. When we take and reveal to a person latent personality and character traits that are in their subconscious mind, and that God didn't make any junk, nobody can tell you what to do but yourself, then the person has the opportunity to hear what they've done. Now, oftentimes, when the case of suicide, and they have a tendency to do same, upon them having a nervous breakdown or a stress attack or trying to kill themselves and it's not completed, and they're sent to us, then we can set them down and find out what's happening in their relationship. At the job, whether it's a wife and husband situation, whether it's a child situation, whether it's a friend, in terms of when we reveal a person to themselves, we let them know what they're doing to fulfill their needs in life. And their needs are what they've done to develop the father-son relationship, mother-son relationship, their boy-girl, man-woman, people-people relationship, their sexuality, their people-people relationship, which consists of their brothers, their sisters, their co-workers, and their peers, as well as we highlight the fact that they need a job. Okay? So, when we sit down, we reintroduce them to themselves such that they can see how explorative they are, how mentally communicable they are, whether they would make the good teacher or the instructor. And we highlight to them how they have been using their abilities. Now, if we see resentment, which is stored anger, if we see the inability to maintain mental discipline and keep things down to earth, then we highlight that. As well as if we see primary temper. Now, primary temper is like a time bomb. One can go off their course in a matter of minutes and hurt somebody. This is one of the advantages, folks. If you're out there feeling stressed, if you're out there feeling as though, hey, I've got to talk to someone, and you want an unbiased counselor to talk to, and this is what I identify myself as, the unbiased counselor, in that no two people write alike, and no one can tell you what to do but yourself. This is another reason why therapy before counseling is not good, in that when you come to me with the trouble, I'm not interested in how many people you punched out. I'm not interested in how many times you got laid off for a day. I'm interested in seeing where you are right now on a subconscious level. Then I reintroduce you to yourself such that consciously you can hear and understand who you are and what you are. And I highlight the personality and character traits now that you're dealing with at the present time. Your emotional disposition as to how you're dealing with people, how you're dealing with yourself, whether you're an extrovert or an introvert, how dependable you are. When you explore the unknown, whether you really get into things and whether you are just fluffing around. If you're analytical, the type that unpretentiously you don't accept anything on hearsay, and you compare everything that you read about, you listen to, you experience with your present knowledge and beliefs, I let you know that. If you're instinctual, being able to listen to a person talk and before they finish the sentence, you know what they're going to say. Enter into a conversation, be there a few minutes, I let you know that. If you're explorative, now this is a situation whereby you have the ability to negate thoughts and things that are no longer applicable to your thinking and being, I let you know that. Such that you can start consciously looking at yourself from a different perspective. And this makes a difference in terms of how you began dealing with yourself. And we also let you know about how you must fulfill your needs and wants. If in fact that you are a good person, you're a leader or instructor. We also highlight the fact that if you're a spiritual person, being a leader, being ruled by the head, being matter of fact with people, dealing with situations that are pressing, and being an instructor, we highlight the fact that you might be spiritual. And if you're spiritual, then you treat people according to their mentality. You give them credence for where they're coming from. If you are spiritual and you haven't been using your ability to the extent that you're qualified, we let you know. Now, oftentimes, people are dealing with what we call fear of failure or emotional repression. When you're dealing with fear of failure, you don't use your abilities to the extent that you're qualified. You're not sure, and you're afraid of making a mistake, afraid of not using it. Also, when you're dealing with emotional repression, being repressed by adult pressure to conform in a certain way by not saying or doing anything that results in guilt or punishment, then you're not utilizing your analytical nature to the extent that you're qualified, as well as your instinctual nature to the extent that you're qualified, as well as your explorativeness. Now, keep in mind, as I said earlier, when you're explorative, you have the ability to negate thoughts and things that are no longer applicable to your thinking and being. To be analytical, instinctual, spiritual, benevolent, being the type of person that always wants to get a job done, being persistent, being able to work well under duress, being compassionate and concerned, indicates the fact that you are a credible person. But if you're going through emotional repression, fear of failure, then we show you in a matter of weeks how to rectify the situation, how to get over it. Oftentimes people say, I don't want to see a shrink. I say, I'm not a shrink. I don't want to see a psychologist. I am a psychologist, but I am a graphologist, handwriting analyst, graphotherapist who approaches your personality and character traits differently than a psychiatrist does. In that, I'm interested in letting you initially know who you are, what you do, how you do it. And then, upon refreshing your mind as to how good you are, then I address the particular situation that's on the top of your mind that has caused you to go wacky. It's caused you to save face or lose faith when you have an emotional outburst or an altercation before anything is done. We can set you down and lets you know what you can do to deal with it. Now, handwriting is brain writing. No two people write alike. It's an unbiased aspect, such that we don't tell you what to do, but we help you tap in to latent personality and character traits that you've had since you were 3 and 4 years old. And as I'm saying again for the second time, God didn't make any junk. You're a beautiful, dynamic person, and you deserve the right to hear this from an unbiased counselor. You deserve the right to begin developing faith in yourself. I often have the expression that people are like Rolls Royces, driving themselves like a vintage Cadillac that needs a 50,000-mile tune-up bad. All of you know what happens when you tune up a car. When you tune up a car, then it runs very good. And we want you to know that you're not a car, but you're a dynamic super being, a spiritual being on this earthly plane. And there's nothing that you can't do. You are important, and we need you. You are your brother's keeper. And so, when you're having difficulty at all, regardless, come and have a stress depression assessment. It takes about 15-20 minutes, and within 24 hours we let you know what's happening. We determine if you have ADD, ADHD, bipolar, bacterial meningitis symptoms and conditions. Being a homeopathic practitioner and a master herbalist, we also do treatment such that within 3 to 6 months, you're on your road to success. You develop more faith in yourself. So, my number's 248-541-4412. My email is E as in Edward, DWARDOHAS at sbcglobal.net, as well as AT&T.net. We're here to help you help yourself, not to tell you what to do. God bless. Talk to us, regardless of what it is. Thank you.